Hi everyone. Today in this video let's discuss 8 important side effects of pantoprazole that you should know. Pantoprazole is one of the well-known medication which is classified as proton pump inhibitor PPI. This drug is having the suffix prazole which can be observed in many of the proton pump inhibitors like omeprazole, rabeprazole, lansoprazole. All these are proton pump inhibitors. Their main role is to decrease the gastric acid secretion. The gastric acid is essential for digestion and proteolysis, which mainly contains gastric acid HCl. But when this HCl is excessively secreted, it can increase the gastric acidity, leading to abdominal pain, burning sensation, indigestion, and flatulence. In such conditions, we can use proton pump inhibitors like pantoprazole. But when we are going to use this pantoprazole, we can observe the different types of side effects which can be classified as acute side effects. These side effects are immediately developed within first few weeks of the treatment, and generally these side effects are mild and they are well tolerated. Similarly, we can see the long-term side effects of pantoprazole, which are mainly associated with suppression of gastric acid. The main purpose of pantoprazole is to reduce the gastric acid secretion, but at the same time, this gastric acid is essential for digestion, proteolysis, and even absorption of few of the important minerals. So, suppression of gastric acid for several days may lead to long-term side effects. The induction of long-term side effects depends on how long pantoprazole is used and at which dose it is going to be used. Generally, pantoprazole can be given at low dose starting from 20 mg and 40 mg. Generally, pantoprazole is going to be taken once daily on empty stomach. But based on the patient conditions and extent of gastric ulcers, pantoprazole can also be given at multiple doses for longer periods. In such conditions, we can observe long-term side effects of pantoprazole. Generally, pantoprazole can be used up to 8 weeks in order to control the excess gastric acid. But in few of the people, based on the gastric ulceration, it can be used up to 1 year, and in few of the people up to 3 years. So in such people, we can observe long-term side effects of pantoprazole. But interestingly, in few of the people, these long-term side effects can also be observed within 8 weeks of the treatment because of any coexisting conditions. That's why it is very essential to know the side effects of pantoprazole. So in this video, we are going to discuss 8 important side effects of pantoprazole and how they are managed. So let us go one by one. First of all, gastric side effects. Since pantoprazole is going to reduce the gastric acid secretion, we can observe gastric side effects with use of pantoprazole, which are acute side effects that are commonly observed in many of the people. So with use of pantoprazole, we can observe diarrhea, nausea, a feeling of vomiting sensation. Even it can produce some abdominal pain and flatulence, expulsion of gases. All these can be observed with use of pantoprazole, which are commonly observed because pantoprazole reduces the gastric acid secretion. But among these side effects, one of the side effects is more important, that is the diarrhea. This diarrhea is mild in many of the people, but in few of the people, we can observe this diarrhea as a severe side effect. And if you observe diarrhea uncontrolled with use of pantoprazole, there may be a chance of development of few of the small microorganisms like Clostridium difficile. This Clostridium difficile is one of the bacterial infection that can induce severe diarrhea. In such people, we can observe watery stools, severe abdominal pain, which is not restored even after several days due to the infection of colon with Clostridium difficile. Normally, pantoprazole will not produce severe diarrhea, but if you observe watery stools and uncontrolled abdominal pain, then you have to check for the development of any Clostridium difficile infection. And particularly, such type of infections can be more pronounced when this pantoprazole is combined with antibiotics, because antibiotics can reduce the gut flora, which increase the Clostridium difficile infection. So this is one of the important side effects that can be produced by pantoprazole. If it is not producing severe diarrhea, all these gastric side effects of pantoprazole are well tolerated within the period of treatment. Second important side effect is the upper respiratory tract infection. Pantoprazole can produce upper respiratory tract infection, particularly in the children. That's when the children, pantoprazole should be used at very low dose for a short period. Because of respiratory infection, children can observe sneezing, headache, induction of cough, fever, as well as muscle weakness can be observed. So these side effects should be closely monitored in the children when this pantoprazole is prescribed. Third one is the vitamin B12 deficiency. This vitamin B12 is also called as cobalamin. The absorption of vitamin B12 is influenced by pantoprazole. Normally this vitamin is present in the dietary protein, which is complexed with the dietary protein, and it can be released and absorbed into the systemic circulation only after proteolysis. This proteolysis is carried by one of the protein, pepsin. Pepsin is available as its inactive form, pepsinogen. This pepsinogen is going to be converted into pepsin in the presence of gastric acid. So gastric acid is required for activation of pepsinogen to pepsin. Once it is going to be activated, pepsin is going to cleave this dietary protein where vitamin B12 is going to be released, and this vitamin can be absorbed into the systemic circulation with the help of intrinsic factor. But here the release of vitamin B12 from the dietary protein is very important, which requires acidic environment. Now pantoprazole can inhibit the gastric acid secretion, thereby it can inhibit the pepsin activation. When the pepsin is not activated, it can reduce the proteolysis, thereby vitamin B12 is not released and it is not absorbed. This results in vitamin B12 deficiency. So you can clearly observe that this process may take long time. So vitamin B12 deficiency is a long-term side effect of pantoprazole. With this deficiency, we can observe various symptoms like fatigue, weakness in the people, headaches, muscle weakness, numbness, decreased functionality of the neurons lead to numbness in the people, loss of sensation, and even we can observe some mood changes, decrease in the mood, and dizziness and lightheadedness can be observed. So if you observe these symptoms with long-term use of pantoprazole, it may indicate any vitamin B12 deficiency. And in few of the people, in order to control these symptoms, vitamin B12 supplementation is required. Particularly, this deficiency is more pronounced in the people with any diabetes or coexisting conditions. Fourth one is the iron deficiency. This is another effect of pantoprazole. Iron is present as a ferric iron in the dietary source, but this ferric iron is not readily absorbed into the intestine. It should be reduced into ferrous iron, which is ready for absorption. Again, this process requires the acidic environment and HCl is required. Now, pantoprazole can inhibit the gastric acid secretion, which reduces the conversion of ferric iron into the ferrous iron. Because of this effect, iron is not properly absorbed, resulting in the development of anemia in the people. So on long-term use of pantoprazole, you may have anemia, resulting in the weakness, fatigue, and development of muscle pains. All these side effects can be observed because of development of iron deficiency. So pantoprazole should be carefully used, and in those people with pre-existing anemic conditions, iron deficiency is more pronounced. In such people, if it is required, iron supplements should be taken in order to counteract the anemia produced by pantoprazole. Fifth one is the bone demineralization. This is another effect of pantoprazole on the calcium absorption. With long-term use of pantoprazole, it can affect the bone functionality and it can reduce the calcium absorption, which results in the increased risk of fractures. So the risk of fractures are particularly observed with multiple doses of pantoprazole for longer periods greater than 1 year of use. So when this pantoprazole is used for long term, greater than 1 year, the risk of bone fractures are increased, as well as it can also increase the risk of osteoporosis. Particularly, it can affect the bones at hip, wrist, and spine. And in those people with pre-existing osteoporosis or risk of bone fractures, pantoprazole should be carefully used. Sixth one, magnesium deficiency. Just like calcium, pantoprazole can also reduce the magnesium absorption. So this results in development of hypomagnesemia. This condition may result in various symptoms like muscle cramps, because magnesium is required for muscle functionality, and it can also produce some tremors and shakiness. Even it can also increase the weakness, particularly muscle weakness can be observed with use of pantoprazole. Seventh one, effect on kidney. Generally, pantoprazole is metabolized in the liver and it is excreted in the kidney. On long-term use, pantoprazole can affect the kidneys, resulting in interstitial nephritis. This is one of the inflammation of renal tubules, which increases the space between the renal tubules, that mainly results in the decreased renal functionality. Even it is not observed in all the people and it is a rare side effect, but it can also be observed in few of the people when this pantoprazole is used for greater than 4 weeks. So even this side effect is not common, but still care should be taken to check any development of interstitial nephritis. In such people, we can observe unexpected weight loss and development of any fever, which indicates the decreased renal functionality. Eighth one, lupus-like reaction. Pantoprazole can produce a lupus-like reaction. It can produce some skin rashes and even it can produce some joint pains, fatigue and weakness. So such type of symptoms can be observed because of an autoimmune disorder, lupus infection. Again, this is a rare side effect, but in the people with decreased immunity or any coexisting infections, lupus reaction can be observed, leading to development of skin rashes and joint pains. So these are the 8 important side effects of pantoprazole that can be observed. The common side effects are mainly gastrointestinal side effects like diarrhea, nausea, flatulence and abdominal pain. But diarrhea can be more pronounced in the conditions like Clostridium difficile infection. Upper respiratory tract infections can be observed in the children, and many of the side effects of pantoprazole are because of long-term use. It can produce iron deficiency, vitamin B12 deficiency, magnesium deficiency, and it can also increase the risk of bone fractures. Even it can increase the lupus-like reaction. All these are the long-term side effects of pantoprazole. When pantoprazole is used for short-term period at low dose, the side effects are very mild, but on long term it can produce some significant side effects. So that's all about today's topic. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.